Okay, great. All right, thank you and good morning. I would like to introduce our presenter. This is the Public Health, COVID and Beyond session. Our presenter is Sara Bosse from the Madera County Public Health. She is the Director of Madera County Public Health and has a fount of information to share with us. So please feel free to put your questions in the chat box and we will read them to her as time allows at the end of her presentation. We can get all those answered for you. Thank you for your participation. And Sara, I will let you take it over.
Good morning. I'm so excited to be with you this morning. You're in the Public Health COVID and Beyond session. Happy to be with you all this morning to talk about public health and how public health is different and wonderful from other types of health careers.
Vamos a hablar de las varias carreras de salud.
We are going to start our journey by talking about something that's really important.
Vamos a comenzar con algo importante.
How we do work, and that's called social determinants of health.
Sara, I'm going to freeze you real quick.
Salud social.
I'm hearing the Spanish interpretation over Sara. I don't know if that's correct. Is everyone?
Should I mute myself?
Bosse, is she still in here? No.
I can also hear double. Trying to see. Rosa, are you here? No.
It shows her in here.
You might not be able to hear us.
I hear you.
Yeah, I can hear you all too. You want to try it one more time and then see if it continues?
So should I keep interpreting or should I just listen?
I think we would do want interpretation, as there may be some families who need it, but I'm just curious to know if there's a button or something.
Yeah, I'm wondering because on mine, on my end, it says interpretation and it says off, but that's on my end, like if I want interpretation. I'm just not sure.
Okay.
This is brand new to us participants, so.
Okay, can you hear me now? Because I just clicked the Spanish.
Yeah, we can still hear you. Just weird. Huh.
I can hear you, Juan. Okay.
Hi, Juan. It looks like maybe you were sent the incorrect. I'm sorry, not Juan. Ernesto. Ernesto, it looks like you were sent the wrong link. Okay. I will email you right now. Could you please?
I see. We're supposed to have Juan, not Ernesto.
All right.
Thank you.
We just had too many interpreters on the stage. Gotcha. Okay. Thank you, Rosa, for figuring that out. Okay. I'm going to let Sara continue now. Sorry about that, Sara.
Wait until he joins. Are we going to?
Juan is here, and I believe that interpretation is happening correctly. It was just Ernesto was in as a regular participant and not as an interpreter.
Okay, well, then I'll press on. We're going to start out with some fundamentals in public health that we use to kind of guide what it is that we're doing. And one of the things that's important to understand about public health is we look at the health of an entire population, not just the health of individual people, because the health of one family actually is dependent on the health of the community around them. And we look at that through the social determinants of health. And when I talk about this, I think most of us are going to go, oh, I understand. Of course, that makes sense. So when we want an individual or a family to be healthy, we have to understand that it's the social and physical environments around them, the experiences they have, the opportunities they have, that also impact whether or not they're able to achieve good health and then maintain it. So economic stability is an important piece to that. Whether or not people are experiencing poverty, if they have a good paying job, if they are able to access healthy food on a regular basis and not be stressed about food, if they have good housing that's not too crowded and meets their needs, and they're not having to move a lot because they may not be able to make rent and then they have to move again. All of that has an impact on a person's health, because your body and your mind and your stress level all have an ultimate impact on not just your health today, but your health into the future. And then education is something that we know for sure. An individual who achieves high school graduation and then enrolls in college has language skills and literacy skills to be able to understand instructions from their doctor. All of those factors play into whether or not somebody is able to keep themselves healthy and their family healthy. And then we look at the neighborhood and the built environment. So how far away is a full grocery store? There are many neighborhoods across the valley in which the closest store is a convenience store with just a few fruits and vegetables and not very many food options. A lot of them come in boxes and not as, whole good foods. The quality of the housing, whether or not that neighborhood has high amounts of crime and violence and environmental conditions, all leading to stress, and also people's ability to make their health even a priority because they have these other competing concerns that make it difficult. And then, of course, we always think of healthcare. Healthcare is one of those things that's really important for people to maintain their health. But it's also health literacy. Are people thinking about the doctor as a resource when they're healthy, not just when they get sick? What we found is when we asked people why they didn't visit the doctor for annual health checkups, they said, because I wasn't sick. And so we in public health are trying to turn that around, that the relationship you have with your doctor, with your healthcare provider, is to help you stay healthy, not just help you get better if you're sick. And then there's the social factors. Do you have a good network of people around you to support you if something goes wrong? How engaged are you in the neighborhood, the community that you're a part of? And do you know that you have a voice to be able to say, hey, my street has potholes in it and it needs to be fixed so that my kids can ride their bike? All of those things ultimately trickle down into the health that we're able to achieve and maintain as a community. In public health, in Madera, this is our vision, mission, and values. And I explain vision, mission, and values using the Wizard of Oz. And some of you are young enough that you might not know the Wizard of Oz, but it's about an unlikely group of people that are all trying to go see a wizard who's going to help them. And the wizard is located in Emerald City. And the whole entire story is about trying to get to Emerald City. And so the vision that you're trying to accomplish is your Emerald City, where you're trying to get to. And it's often aspirational. It's hard to achieve. It's something that we work towards and we may never actually get there perfectly, but we're still kind of after it. And so our vision at Madera County Public Health reflects and shows the social determinants that we were just talking about. So you might think that the health department is, because of COVID, really looking at minimal communicable diseases over on the left-hand side of this fan. And we are, and we're using valid and reliable data to be able to show us what to do and how to do it. We're also after people having quality health care, but we're also interested in people making healthy behaviors, are making healthy choices and having healthy behavior, like choosing to not smoke, for example. And we're interested in healthy community design, making sure that food is accessible, making sure that we have bike paths and walking paths, our own department, which you saw a picture at the beginning of the presentation, has a health trail around the whole campus. And when we built that, we wanted to have something for the community that was going to increase their physical activity. And so we think about that healthy community design. Access to healthy, affordable food, we've talked about that a minute. Safe neighborhoods, I mentioned. We're looking at a clean environment, which is water, air, our soil. We want those to be clean as well. And then economic vitality, I mentioned having a good paying job and whether or not a family is experiencing poverty. So we're interested in economic growth and healthy businesses. All of those are important. We work on a lot of our projects in collaboration with other people. We, for instance, this last, it was a year and a half ago, we passed in collaboration with the city of Madera, a smoke-free parks ordinance. And those kinds of policies help shape the design of the community, but you can't accomplish something like that all by ourselves as a health department. We need to work with other partners. And we have a commitment to community in how we work. And so that's the vision that we're after and what we look towards. And our mission is what we do every day to take steps towards that vision. And we do that by leading, protecting, and empowering the community. We have guiding principles that govern how we work. A culture of honor is really important to us. It means we show up as people with honorable actions and behaviors towards others. And that helps us really stay on our mission and get to our vision. We have lots of services that are provided through Department of Public Health. And these are similar no matter what county we're talking about. And many of you might be in Fresno County, Merced, Tulare. And so many of the health departments have a lot of the same things. There are some differences from place to place, but it's largely the same. So we provide to our employees and our staff TB testing for new employees. We give flu vaccinations to the community and to our employees, obviously COVID testing at this time. We have a public health laboratory, which I'll tell you a little bit about. And we do, drug testing for our probation department. In the clinic, we offer to the community immunizations and flu shots and COVID shots, HIV treatment. We have mobile clinics that we take out to remote areas. Our lab is a state-of-the-art lab, and we have just retooled and brought in lots of equipment to be able to do rapid, high-volume COVID testing. But we do water testing for our ag community and drug testing as well. We also have a office that's called Vital Statistics, but it's basically birth and death records. And then we have a medical marijuana program as well. We also house something that would seem very familiar because we, of course, prepare all the time for emergencies and being able to respond to public health emergencies. Diseases like COVID are one example of a public health emergency, but we are involved every time there's any type of emergency that might impact people's health. So our nurses are sent out to shelters when there are fires or evacuations. We participate in really any outbreak that happens. And COVID is the one that has really brought this to light to the community. Most people did not know what a Department of Public Health was. I never heard of it before. And I'll talk a little bit about my story and how I ended up in public health towards the end of this presentation. Oops, hold on a second. Okay, so other services that we provide in the county are less clinical and more on the side of those social determinants that I talked about at the beginning. Our WIC program, which stands for Women, Infant, and Children, is a program that many of you may have heard of before. It's been around for a very long time. And what they do is they work with women who are pregnant and who have had their babies and with their kids up to age 3. And they provide them with vouchers for healthy foods. Because what we find is that if we work with moms when they're pregnant, especially moms that struggle with some of the social determinants I talked about, and help them eat well and take care of their bodies when they're pregnant, then there are better outcomes for their pregnancy, for their babies. The babies are more likely to be healthy and the pregnancy to full term. And so that nutrition education is also something that we're investing. So we give them the moms the food vouchers, but we also teach them about nutrition, how to cook healthy meals, the important things to include once the baby is born. And that part of that is the importance of breastfeeding and the benefits of breastfeeding for both mom and baby. So we have breast pumps that we check out to moms, and it's a really great program. It's actually our largest program in Madera County Public Health. And we have great success in helping families have healthy pregnancies and babies. We also have lots of wellness services, and these are just a few examples. We do car seat education, distribute car seats to families that have a hard time getting them, and how to correctly install them into the car. We do lots of wellness education around a variety of topics: diabetes, heart disease, tobacco prevention, social determinants of health, and advocacy training to help the community understand, like, how do they look at their environment and see the social determinants and then do something about it. As a resident who has a voice and wants things to change. And I'll talk about some of the things that we've done related to advocacy in just a second. Diabetes prevention program is a 16-week program with groups of people that are at high risk for diabetes based on a blood test. And diabetes is an interesting illness. It's something that's very preventable, but oftentimes misunderstood. And so we give people the tools to be able to take their health in their own hands and modify their diet and their activity to be able to prevent getting diabetes. And then I talked a little bit about environmental change. The health trail is one example around the Health and Human Services complex. But another example is our team has been working with the community and doing kind of walk audits. And so they pull together a group of people from a neighborhood and just walk around as a group, and they make notes and they talk about what are the issues, what are the problems, the safety concerns. And they identify things like broken streetlights, broken sidewalks, where trees roots may have come and broken them, and it's not safe and it's not easy to walk the neighborhood. And a lot of our issues are challenges with regards to kids walking to school. You can see the walking school bus. Some of those are just safety concerns, but in Madera, we have a lot of intersections that kids would need to cross to be able to get to their school, but that's really not set up safely. There's not a crosswalk with lights that can easily be crossed many places without sidewalks at all. And so we were able to complete those walk audits and present them to the city of Madera, the issues and concerns from the citizens that were part of the walk audit. And we've already had the city prioritize and improve one of those intersections to make it safer for kids to walk to school. And so I talked about coalition leadership and the importance of working with different partners. Cities are only one of those partners. We work with the Transportation Commission. We work with all of the school districts, the superintendent of schools. We work with all of our healthcare partners, hospitals and clinics and doctors. We work with Parks and Recreation. It's lots and lots of people that are at the table and working together. And then we also have things in which we're doing more intensive case management with families that have particular challenges. So WIC is kind of like that. We're working one-on-one with a mom through a several year period. We have others that are in more intensive home visitation programs. And these are for moms with very high risk pregnancies, oftentimes due to social determinants. Sometimes it's a young person who's gotten pregnant, and so they have unique challenges and they need support. And so we have teams of people that will actually visit the home and establish a relationship with that family and walk them through the pregnancy and the first several years of their child's life. Building skills, not just for food and nutrition, but lots of different parenting skills to help them get off to a good start, help them identify the resources to keep them in school, if they've completed school, to be able to achieve and find a good job and keep that job. And perhaps continue their education if that's what they'd like to do. And then we have a program that's called Children's Medical Services. It's almost like health insurance for very sick kids who need lots of support and coordination of their medical care. And the Gold School Physical Therapy is actually a physical therapy clinic located at a school. And we work with kids that have lots of physical disabilities to help them improve their movement, but also get situated with wheelchairs and other help that they need. And that's the low-income durable medical equipment that we provide. Next, I want to talk about public health staff, because I know all of you are thinking about careers either in medicine or healthcare, and I hope you'll consider public health as well. There are lots of staff in public health. Our department is usually about 100 people. With COVID, we've expanded to 165 right now, and we're still hiring more people to help us because vaccination is a big effort. And we in Madera County don't have very many providers that are providing vaccination. And so our Department of Public Health is working to provide vaccination to people as the vaccine is available. And so on the right-hand side there is a picture of Dr. Paul. He's our health officer. And so I'd like to just tell you a little bit about how a health department is put together. I'm the director, and I work alongside Dr. Paul, and we have two roles, and we work together to lead the department. He is the clinician. He's the doctor, the medical expert, and all of the decisions related to medicine and healthcare, he is the one who oversees all of those. And I'm the director who's an administrator. So Department of Public Health with all of these programs comes with lots of budgets and contracts, lots of supervision of staff and strategy about how to put these pieces together and really roll it out in an effective way. And that's my job. So we work hand in hand, and in COVID, that's definitely been true. There have been medical things, research that we've learned about the virus. How does that get applied? And how do we really help the community understand how to prevent transmission of COVID? And that's Dr. Paul. And then my job is, how do we get enough people and the right people and all of the equipment and use the resources and the money that we have to be able to deploy the services that are needed so that we can do contact tracing and investigation, so we can test people for COVID, so that we're able to vaccinate people as vaccine has become available. All of the public messaging that happens. So I know you've seen people on the news and you've watched all of the messages on social media and things like that. And the ones that are coming from health departments, we have a whole team of people that are putting that together so that people are well informed. In terms of our staff, we have lots of people that are involved with medical care, care management, and coordination. So our public health officer, Dr. Paul, and then we also have other clinical physicians that come and work in our clinics. we have public health nurses, and public health nurses are registered nurses, but they've completed a certificate program that really gives them the extra information and ability to use the social determinants to apply to the work in public health. And I really encourage you, even if you are thinking about being a registered nurse working in a hospital or a clinic, I'd encourage you to get your public health certificate, because it does give you skills to be able to treat the patient as a whole person. We often give instructions to people: eat more fruits and vegetables, take this prescription, reach out and get this test done. But we don't necessarily ask them, do you have any trouble with getting to this appointment? Do you have a car? Do you are you able to use the bus to get to that place? Is there a grocery store in your neighborhood that you can eat more fruits and vegetables? So more than just telling people what to do, understanding the context that people are in to help them achieve the goals that we all have. And then, of course, licensed vocational nurses as well, medical assistants. We have in the bottom there, you can see the core of our lab team. We have added, I'd say, 6 additional staff. It's typically these 3 people at the bottom of your screen, and we've tripled that number to be able to do COVID testing. And then obviously I talked about the physical therapy clinic that we have. We do have a physical therapist and an occupational therapist at that clinic, and lots of caseworkers that help us with our home visitation program and in WIC. And then epidemiology is a big word you may have heard of or not. Epidemiology is the study of public health. It's all of the data related to the health of a population. So for instance, our epidemiologist just went through and looked at the data from the death records from the year 2020 and was able to tell us that COVID was the #1 cause of death in our county. She was also able to tell us that even though farm workers represent only 13.8% of our population, they represented over 35% of the deaths. So farm workers were at higher risk, more likely to die of COVID than other people. And so we have prioritized, and you may have seen in the news or heard that farm workers are eligible for vaccine before other groups. That's why, because we look at the data from our epidemiologist and we develop strategy based on what we've learned and what we know. So that data is always happening, always flowing, and it guides what decisions we're making on behalf of the population, the community as a whole. So Dr. Paul is our public health officer, and the easiest way to understand that is if the county of Madera was one patient, he would be that one patient's doctor. He considers what the health of the whole county looks like and how we can best treat it. So we have a farm worker population that is more likely to die of COVID. Our treatment is to push more vaccine towards that population so that we don't have that inequity and we're able to keep people out of the hospital. So that's, let's see, some of our staff. And moving on, oh, I didn't update this. When I first did this presentation just 3 months ago, we were at 135 staff. So we've hired 30 staff in just a few months. We also have behavior change specialists. You might have gotten the idea that we're really after people's ultimate behavior change, but we create that environment so that they're able to make those behaviors that help them maintain their health. And so behavior change is actually a specialty. It includes not just education, but helping people build skills. And it also includes that public information, really putting messaging out that's effective. It has a bunch of science behind it, marketing science. It also has science in terms of cultural context, what their current experience is. So we talk to the community and we listen to them about what are the real concerns, what are their issues, what are their barriers to getting a COVID vaccination, their concerns. And our messaging addresses those concerns so that we're able to bring them to a place of feeling comfortable with that behavior change. And then policy and systems change, I've been talking about since the beginning. That's really looking at those social determinants and how do we work upstream. So there's a story about policy and systems change that really helps people understand what I'm talking about. And here's how the story goes. There was a group of people and they were walking alongside a river. And all of a sudden there was a child that was coming down the river, and the river was moving really fast, and that child was drowning. And so they worked together and they got the child and they pulled him out of the river. And as soon as they got that child out of the river, there was another kid coming down the river, also drowning. So they worked really hard and they pulled that kid out of the river. And then there was another one and another one, and they kept working and they kept working harder, and they couldn't get them all. And so they were just working frantically to try and save as many kids as possible. And eventually one person from that group stopped and they started walking upstream from where the kids were coming from. And everybody was upset with them. Why are you leaving us? You have to help us save these kids. And the person said, I'm going to go upstream and find out how the kids are falling in the river. And that's what we're doing in public health. We want to find out what's happening upstream. What are those things that are causing the outcomes that we see today? So if we have kids that are experiencing high rates of suicide, we want to know what are the things that are happening contextually, like around them. What are their experiences that they're having? So what's the system that they're part of? But what happened earlier? What happened in their childhood? What happened in their relationships? Why do they find themselves in this place of despair? And if we can figure out what that looks like, we can help that person better, but we can also look at keeping kids from falling in the river of suicide or thinking about suicide. So that's one example of how we look upstream. Another way we look upstream, for instance, is how were our neighborhoods built in the first place? And why were they built that way? And understanding the motives of how things developed, where the money came from and where it flowed from. And then if we can figure out the puzzle of how it came to be now, then it helps us sort out how to fix it. So then, of course, with all of these people, we have a lot of jobs in administration, in human resources, in managing all of those budgets, in clerical. And so I will talk a little bit about how you find yourself in a career in just a minute, but I want you to open up the idea and scope of all the different ways that you as an individual could contribute to the health of your community. You don't have to look just like a doctor, or you don't have to look like a nurse. What if what you really love is accounting? You can still have a great impact on health using accounting. Our deputy director, he is so great with numbers, and without him, we never would have been able to sort out all of the new pots of money that are coming to help us be able to respond to COVID, because we have to track all that money and be accountable for it and be able to spend it all in a way that really serves the community. And if we don't have those people helping us with the budgets in the background, it all falls apart. So it's not just the person who's at the front who gets seen, it's all the people behind them that are important. And you can be a part of a team that really impacts the community with the skills that you have that are individually yours. You don't have to be like anyone else. You can do the things that you love and that you're really good at and be a part of contributing to the whole process. So I'm going to talk a little bit about my path to public health, just so you can see that it isn't always a real clear, direct thing. Many of us did not decide who we wanted to be and what we wanted to do early on. I've always been good at math and science. I love math and science, and I've always been good at it. And lots of people told me, you're good at science, you should be a doctor. And I liked the idea of being a doctor. I care about the health of the community. I wanted to impact people's health. That sounded great. And I went off to college and I was pre-med. I was studying chemistry and I liked what I was studying. But there was a point in which I thought, well, I don't know if I really want to have the life of a doctor, because I know they work oftentimes long hours. It's harder for them sometimes to have a family. And I've always wanted to be a mom. I have 2 kids that I carried, and then I have 3 stepdaughters as well. And I love being a mom. I always knew I wanted to be a mom. And so I sat down with my own mom and said, I just don't know if I want to be a doctor, but I know I want to do something related to health. I just don't know what it is. And I had gotten really interested in nutrition when I was in high school. And my mom said, well, I have a friend who's a registered dietitian. Maybe you should go and talk to her. I went and I talked with her, and it turned out that Fresno State has this great dietetics department. So I switched my major, switched universities, started going to Fresno State, lived at home, and got my degree in dietetics. And while I was doing my degree, I volunteered at the hospital, and I did kind of the basic functions of what a dietitian would do. And I worked under a dietitian and kind of learned what it was like to be a dietitian in a hospital. And I hated it. And I thought, oh no, I don't know if I'm in the wrong degree again. But I went and talked to my professors, and they said, well, you don't have to be in a hospital or a clinic. You don't even have to be a registered dietitian. You could get your dietetics degree and you could be involved in community nutrition and obesity prevention, which is how I found my path to public health. So I graduated with my degree in dietetics, and I had a couple jobs that were not in nutrition at all. The first one was at a clinic, and I helped with a program that provided education to women who have breast and cervical cancer. And so I learned how healthcare works, how it pairs with education, and the importance of really keeping in mind like the social determinants. I started learning about social determinants because many of the women could not pursue the treatment that they needed because they couldn't access it. And so I worked there for a little while and I learned that. And then that job I was traveling a whole lot and I didn't like that part. So I really wanted a job that was closer to home. And the only job that I could find right away was an activity director at a retirement community. And so I worked there for 6 months, and I planned bingo, and I did exercise classes with seniors, and I wrote newsletters, and I took them to restaurants and hung out with all these amazing seniors. But I learned amazing skills. Planning the social calendar of people in their 70s and 80s requires a lot of diplomacy. And I learned a lot of skills in how to help people move towards a decision together as a group. And that has served me in my whole career, just that 6 months as an activity director. The skills of even doing like graphic design and things like that for the newsletter were really important to me. And then I got my first job in nutrition education. It was for a nonprofit organization, and I recruited teachers to use curriculum to teach nutrition in their classrooms. And I loved it. It was great. I worked there for about a year and then worked at Cooperative Extension, building nutrition education and obesity prevention programs for 15 years. In the time that I was there, the program went from just a few people to over 20 people. And I had a big part in growing that program and leading that program to expand nutrition education in school sites and in the community. And to this day, that program is still very large and thriving and out there doing great work. And then I was approached by the health officer and director for Fresno County Department of Public Health, and he encouraged me to apply for a job at the health department. And I was successful in becoming the manager of their Office of Policy and Planning. And that was where I really led programs in policy and systems change: tobacco, obesity prevention, physical activity, diabetes, hypertension, those chronic illnesses. We were really doing that wraparound stuff to prevent things. And then 3 years ago, I became the director of the health department in Madera County, and my scope became much broader. And so it was I didn't ever start out saying, I want to lead a health department. I actually didn't really understand what a health department did until I started working at one. But I knew that I wanted to be involved with health. I knew that I wanted to help my community. I knew that I wanted to work with people. And every step along the way, I pulled from the experiences that I had. So the key principles I want you to take away when you think about your career is do some research in person. I know that it's really tempting to Google everything online and watch YouTube videos and read things. But the truth is that what you get online is not the same as going and seeing what people do and talking to people who do it. And it is a great joy for me to talk with students and to work with them and help them find the path where they need to go. So I really encourage you, and obviously COVID brings in some challenges, but it's not going to be like this for forever. You have the opportunity to go out and visit and meet people. Even if you're kind of introverted or shy, go out and see people. So think about the life you want, not just the career you want. What are your values? What kind of salary are you looking for? Do you want to have a family? And think through those things and make decisions with that whole idea in mind. Discover where you want to end up and talk to people about how to get there. I talk to people all the time that say, I want to do this and I'm going to go get this degree and I'm going to work here and then eventually it's going to take me to that. And it's absolutely the wrong path. That's not what's going to actually get them where they want to go. So find people who can tell you, if you really, really want to be this, what's the best way to get there? And then the last is, don't underestimate the value of where you are now in your journey towards the goal. When I was an activity director in the retirement home, I honestly was like, I'm not doing anything related to my degree and I'm frustrated. But that 6 months has been so, so valuable to my skills. And so don't underestimate that. So are there questions that I can respond to?
Such great information. Thank you for covering such a broad subject, Sarah. I don't have any questions yet in the chat. I just want to remind participants, if you have a question, feel free to type it in the chat and we'll read it out. We are getting some thank yous. Okay. Well, good thing to know is if they have questions for you later, Sarah, I know they can find you at Madera County Health.
Are you able to send mobile units to vaccinate farm workers? Excellent question. Yes. Mm-hmm. We are prepared to be able to go out and vaccinate remotely. Right now, we have a team assembled. We collected data. So just like I talked about epidemiology, we collected data. We went to our ag commissioner. So this is a great example. You have to partner. We got information from the ag commissioner and the farm bureau about who are the employers, the lists of farm labor contractors and things. And we're mapping all of that out. We're using GIS to help us map that. And then we're reaching out to those employers and finding out how many employees do they have, how many are interested in vaccination. And then we are scheduling those vaccine clinics. We're finding out who has a place that can host a clinic. And then we also have mobile clinics that are on order. They're going to be delivered, and we'll be able to use those facilities as well.
I have to say for myself, I'm glad that you addressed the farm worker because that was a question I had. Thank you. And if you can see the comment that was shared by Ivory.
Yes.
Very good. Thank you, Ivory.
I actually know very few adults who didn't go through several different types of jobs before finding the right fit for them. And even as adults, many people go through different phases of their career. And so be open to a pathway that might take you in another direction as you learn more about yourself and what opportunities are out there. My husband teaches in Madera. I want to thank you for vaccinating the teachers. Our pleasure. We want to vaccinate everyone.
Awesome. Thank you again, everyone, for participating. We're going to go ahead and end the recording on this session. Oh, how many people get vaccinated a day?
Yeah. How many people get vaccinated? It depends. So we don't have a stable allocation, and we don't vaccinate every single day. Per week, we're doing about, so just public health, we're doing about 2,000 to 2,500 a week. And across all of Madera County with all of the different providers, hospitals, clinics, and things like that, it's about 5,000 a week. And some of those are first doses, some are second doses. So we so far have gotten to about 44,000 doses we've given out, and about, well, it's actually more than that. It's more like 48,000 doses and 22,000 people.
It is true, Hua. You will find your fit. You still have a lot of years ahead of you to experience and learn. You'll find your fit. Don't worry.
I think that there are a couple tools that I'd recommend if you're really searching for what is the best role for you. And the first is what is called Strength Finder. So you can Google Strength Finder, and it is an assessment that gives you your top strengths. And your strengths are really how you show up, what kinds of things you do that make you feel stronger at the end of the day. So mine are strategic thinking. I'm futuristic, which means I like looking at the future plans of things, and I'm good at that. Interpersonal relationships, so not big crowds, but individual one-on-one relationships is a strength that I have. Being very pragmatic and realistic. So there's 34 different strengths that Strength Finder identifies, and they've had 30 years of data that's helped them develop this test that you do. And it's been really helpful for a lot of people in figuring out like the kind of thing that I would do looks like this. I'd use these skills, and at the end of the day, I'm going to feel better and stronger using these skills all the time. So I can find a role that helps me do that. It's better. And then really defining like, what are your values of what kind of impact do you want to have? Are you interested in medicine because you want to see an individual person change, or do you want to see a community change? Asking some of those important questions.
Thank you. All right. Thank you for attending this session on public health in Madera County. And I know it generates to Fresno County as well. The counties aren't so different to where we aren't seeing the same things here in Fresno as we are in Madera. I just appreciate Sara recognizing that and being able to present to all of our JDA and DA students and families. I'm going to stop recording.